Hey, this is Dr. Jamie Friedman, and I'm checking in with you guys from my office in San Diego, and it's not very busy. As expected, people are maintaining their social distance by staying home, especially if they only have mild symptoms, so we're not seeing a lot of patients. I think a lot of people think we're super busy, and in fact we actually haven't been. We haven't been for the past few weeks. So I wanted to check in and let you guys know what is happening from our perspective on the front line in primary care pediatrics. So starting a few weeks ago, our group was very much on top of planning for coronavirus and for a pandemic. So while our numbers were going down in the office as people were getting a little worried and wanting to stay home and stay away from public, we were just constant meetings, emails, preparation, and it's just changing day by day. Keep in mind that as doctors, we are learning along with you guys about this virus and what the best course of action is going forward. So every day things change. So to get your information, please check with accurate medical sources. For me, as the Director of Marketing at Children's Primary Care Medical Group, I am working really hard with my team to make sure that we're keeping the information on the website updated and that we're putting out accurate information on our blog, as well as on our Facebook pages, including my own social media pages. So please keep checking back for accurate information. So how have things been for me this week? Well, this morning I can tell you I went through a wide range of emotions, just thinking back how it's been and where we are. So at the beginning of this week, once it was known that school was closed, I started to really feel some panic. I'll be honest, I was terrified coming to work. I was terrified that I would be seeing really, really sick patients, that my staff would be at risk, that I would be at risk, and ultimately I'm terrified of bringing this virus home to my family, especially to my spouse who is on chemotherapy right now. So coming to work every day has been tremendous amount of stress for me. As the week has gone on, I can tell you I'm not seeing patients that at least here in my little pocket, that I'm worried about coronavirus. I feel actually fairly protected. We're seeing well patients in the morning. The mornings go extremely smoothly. We're keeping the office very, very clean. Lots of hand washing, cleaning surfaces, handles, all of our equipment. We are seeing sick patients in the afternoon. I'm wearing masks and gloves, washing my hands more than I even normally do, which is a lot. And so we're doing the best that we can to prevent ourselves from getting sick and to keep our patients safe. So as the week's gone on, I have felt a lot more comfortable, and I'm here for you guys. We're not closing, we're not going anywhere. I do want to let you know what is our home process. So before I leave, I disinfect my whole workspace, including my phone, and I wash my hands. When I get home, all my clothes, including my shoes and everything I've worn, stays in the garage. I put on clean clothes. I go inside, I disinfect my phone and the handles and everything I've touched, and then I go right into the shower. And my clothes go right into the laundry. So I'm doing a lot of laundry. And I did just order scrubs. Gosh, I haven't worn scrubs in so many years that I didn't have any, but I did order some because they're a lot easier to wash. So that's what's been going on. So as the week ended, I felt pretty comfortable and pretty confident that we got this. This morning driving into work, it just was so quiet out there in public and in the space that I just suddenly got terribly sad at where we are, at how disconnected we've become, how nothing is really functioning. I'm so sad for what's going to happen with the economy. I'm so sad for workers who just rely on us going to their businesses. And it's tremendous. It's a tremendous weight and a tremendous pressure to get this under control so we can get back to normal. When I was in the hospital seeing new babies, yes, because new babies, they don't wait. They're not staying isolated. They come when they come. Everybody's washing hands great, cleaning the surfaces, keeping things safe at the hospital for all of you guys. And I started talking with the nurses, and it just made me feel so secure and comfortable as a primary care pediatrician that I'm not on the front line the way my colleagues in ER or ICU or anesthesia are. I'm so thankful that I'm not the one in a waiting room filled with patients who are coughing. I'm not the one doing the intubations or having to decide, do I put my PPE on to go into a room to see a patient with coronavirus. So to all of my colleagues, doctors, nurses, techs, RT, environmental staff, everyone in the hospital, in the ERs, in the ICUs, in the ORs, my hat's off to you, because I'm horrified as it is coming into work seeing well children, and you guys, you are all exposed way more than I am, and I'm just so grateful for everything that you are doing for our patients. And I got to work thinking, okay, I got this, I can do this. My fear has turned into resolve. We're going to get this done. I'm sad about how things are going. I'm certainly sad about how our government has responded. But I am so proud to be a physician, and I'm so proud to be in a group of people who are continuing to work and continuing to take care of everybody. And I just want you all to know that I'm good. My kids are good. As far as our household, we're doing our best to keep things clean and protect my husband. And finally, I just want to end with a tremendous amount of gratitude. Every patient, every family member, every friend, near and far, who has reached out to ask how we're doing, how are things in the office, stay safe, sending donuts. Okay, you don't need to send any more donuts because I'm gaining some weight. Sending thank you letters, sending emails. It means so much to us. Every patient that leaves telling us to stay safe, thank us for being here. You don't know what that feels like, because as scared as I am to come into work, it makes my heart so full to hear the thank yous, and I'm so grateful for all of you for reaching out. It means a lot to us, because this is hard work, and we're really, really appreciative that you guys are appreciative. So thank you, and thank you to everybody out there who's just keeping it together. And thanks for letting me ramble and letting me check in, and we'll keep you posted. Keep coming back to all our social media pages so that you can be getting up-to-date information. All right, thanks. Take care, guys.